And today's topic is game-changing diagnoses. So we thought that would be a good little play on words with the Super Bowl coming up. But in all seriousness, anytime being diagnosed with cancer is game-changing. It's life-changing. And there's so many pieces to it. Oh, good. That is my sister, Lori, and she could see us both. So good to know. Um, but anytime you're diagnosed with any illness, but with cancer specifically is what we'll be talking about. It's life changing, and there's so many different parts to it. It's a really difficult process. So we're each going to just tell our stories, but we both were saying how long they are. So we'll try to condense it a little because it is so complicated. So for those of you who might not know, I had lymphoma. I had blood cancer, non-Hodgkin's lymphoma, and it was stage 4 by the time it was found. But I was also pregnant. So that is what made it very complicated for me to be diagnosed. So I think I was just trying to think, like, how am I going to even tell this story? Like, what was the first sign? And I think I'll start with, it was August 2014. And at that point, I was 6 months pregnant, and we had gone to Home Depot just to go buy paint, believe it or not, for the baby's room. And we're picking out this beautiful, like, pinkish purple, which my daughter Valerie loves to this day. And I was talking a lot, like I do all the time, but now I was saying to my husband, oh, like, look at this color. This will be great. Let's do this. And as I'm talking, I'm just starting to feel very out of breath. And I've only gotten that feeling like a few times in my life, and where I've actually passed out. I felt it coming on. I was like, I think I'm going to pass out. So he was very nervous and said, what do you mean? And my instinct was to kind of like walk till I found a place to sit, which probably isn't the smartest thing, but I felt like I knew it wasn't happening yet. If anybody, I don't know if you fainted, Aliesha, before, but if you know, like, the feeling of it coming on, or if anybody else knows what it's like, sometimes you could kind of feel it coming on. So I made it to like the entrance and sat on like a cement block or whatever. I don't know, like the little curb cut thing. And next thing I know, my husband just hit in my face and saying, wake up, wake up. And it was so scary that I actually did pass out just for like a few seconds. They're pregnant. And he's like, come on, we have to go to the hospital or something. So we were he was definitely happy that it didn't happen like right in the middle of the store, because then I don't know who knows if it was like in the store, what would have happened as far as like filling out paperwork, and I don't know, they would have been more in their like control. But I called the doctor right away, and they said come to the hospital. And what did they do? They put me on a fetal heart monitor. They put the fetal heart monitor and checked the baby. She was fine. I'm sure they checked my vital signs. I don't remember a lot about it. Well, they definitely did, but I don't remember like a lot of the details. But it was mostly like the baby is fine, and I was worried about the baby too.
Yeah.
Keep going. That's it. Don't worry about it. Let us know if you ever feel anything again. So I went back to work. We were both teachers, for anybody who might have missed the last one, if you didn't know, or anyone watching this back. So I was teaching at the time. I went back to work. It was hot. I remember just feeling gross, but I'm pregnant, right? Like, it's hot. That might have happened anyway. I still don't know that some of these things that were going on with me. So now I'm working, and really feeling like I can't do this much longer. So I'm thinking like, maybe I should stop soon. Maybe I should stop. But I'm just a go-getter, and I kept feeling like I should keep pushing. So I did. And then I remember one of my checkups with the gynecologist, I was like, I don't know, in the shower, I kind of saw these lights. And they're like, that's not any visual disturbance. That's not a good sign. Again, they sent me to the hospital, checked the fetal, put a fetal heart monitor. That's checking the baby. She was fine. But this time they said, you know what? You should probably go see a cardiologist just to make sure, everything is okay. Because I guess they were seeing maybe my heart rate was a little fast, and I don't know, it was recommended. Some of this is like escaping me now, but anyway, so I went to my dad's cardiologist. He said, I want you to wear a heart monitor for a few days, like a week. Let's see what's going on. Let's make sure that everything's good. Because we don't want to like put pressure on your body and you're pregnant. This is not good. So he found out every morning he saw this activity that my heart rate was going so high when I would walk into the building. He was like, "What are you doing at 7:30 every morning?" I'm like, "I'm walking from my car into the classroom." And he's like, "Well, you're overexerting yourself." So he said, "I can't give you medication right now, but your heart rate is very high, very fast, and I don't like what I'm saying, but like I can't prescribe you with anything if you're pregnant, and I can't really figure anything else out right now. But I don't like what I see." And then I went back to my gynecologist, and they were like, "We see this all the time. You're pregnant." They kept kind of pushing. It's normal. It's normal. And I remember crying because I'm like, "What do I do? Like, I'm gonna use all these days. These are the normal things you think.
Yeah.
Probably like the logistics. Probably I shouldn't have cared so much about that. But I'm like, all right, I guess I'm gonna stop working like a month earlier than expected. But I wonder why this is happening." And then, like, I just started to feel worse and worse at the last month of pregnancy, but I had never been pregnant. So I'm like, I guess it's normal to have these pains. And some of them might have been, but I was experiencing, like, I had this upper back pain. So that, when I talked to some of my friends, they were like, I had lower back pain. I don't know. I had these different things going on. So finally, she was born. She was breech, so I had a C-section. Healthy baby. I was fine. I thought. Except the next morning after I had her, I finally was able to eat because they don't let you eat right after the surgery. I go to have my breakfast, and this is one of those things again. I call my mom. I said, "I'm eating. I feel so good. This is great. I'm finally getting to eat." I'm talking and talking, and I feel like I went, "Oh, I think I'm going to pass out." My poor husband. So he's like, "What?" But there was a button on the wall. You could call the nurse. So he calls the nurses in, and they gave me, like, I don't know what it's called anymore, like a smelling salt type situation to keep me awake. I didn't actually pass out. And I'm like, when am I going to wake up? But it was like I was passing out. So it was so weird. And they're like, "You are awake." And I'm like, "Oh," I'm like in this weird state. And they're like, "Don't worry. This happens to a lot of women the next day after giving birth or after the surgery, if you have a C-section after the surgery." I'm like, "Okay." But it was the same kind of like losing my breath type of thing. All right. So then that passed, and it didn't happen again. But now I'm supposed to be walking, improving, so I can go home. And I felt like I couldn't walk down the hall, like so out of breath. I'm like, "Is this normal? Am I going to walk out of the hospital tomorrow, or will I be in a wheelchair?" And again, like, gynecologist, like, "Oh, you're fine. We're going to walk out. Everybody walks out. What do you mean? You'll be fine. Don't worry." But like, I don't know. Like I said, I'm very like strong and like determined. So for me to feel like I couldn't do something was very weird. But I guess I should just cut to this at this point. When I never knew this before, but with blood cancer, it's going through all your lymph nodes, which makes them swell. So at that point, mine were swollen on the inside. So I didn't have any physical outside symptoms, but they were swollen in my chest. And that is why I was passing out. Could any of it be attributed to pregnancy? Possibly. Maybe the two factors made it worse, but that's why I was out of breath. I had a huge mass pressing on practically my heart at that point.
Oh, my goodness.
So that's why that was happening. And eventually the oncologist said, once you start seeing signs on the outside, like when your lymph nodes are swollen on the outside, it's already been on the inside. So you had to have had it while you were pregnant, because there's no way it could have progressed this much in this short amount of time. So back to like where I was. So I had her. Now I'm having all these visitors. It's exciting. I felt okay for a while. When I first got home from the hospital, I felt cold symptoms. Again, I'm like, I was in a hospital. Maybe I picked something up. My husband also felt a little sick, so we just blamed it on that. He felt better. I never did. So I went to a walk-in, just because it was right convenient near my house. And that first person that I went to after I gave birth, that doctor said, consider getting a chest x-ray. And I wish he would have said why. And I remember going home like so nervous, like, what could be wrong with me? What? That's so extreme. I'm just going to take the antibiotics he gave me.
Yeah.
And I did. And I felt, I don't know. I felt okay at times. I didn't feel like at that point progressively worse. I felt all right. I kept maybe just convincing myself I was better. And like I said, all these people are coming to see the baby. It was a happy time. It was Thanksgiving, and then it was Christmas. But after the first round of antibiotics, I started to feel sick again. I saw my doctor, general practitioner. I went, and he said, everybody's sick. Everybody's sick this time of year. Here's some more antibiotics. I'm going to give you something a little stronger. Okay, great. I want to get better. I believed him. I took it. He did not give me any second steps except for a stronger antibiotic, which I never went through any of this before. So I'm like, okay, great. I have something that I could take. Now Christmas comes and goes. And now it's like close to New Year's, and I felt really sick. And this is the first time that I got a fever. So we had company over, another group of friends coming to meet the baby, and my sister was there. I think she's still on here, but I'm like, oh my god, I just don't feel good at all. I don't know what to do. I actually like laid down on the couch, and she's like, we gotta go back to the doctor. She brought me back, and this is the part where I could get very angry or very upset thinking about it. So this is the second time with my doctor, but this is gonna be the third round of antibiotics, and he's aware that I already had taken a round. He says the same type of thing. You need something stronger. We really gotta, you had a baby. We gotta boost your immune. Maybe your immune system's not what it was right now. Let's give you another round of antibiotics. And I wish at that point I would have said, I want further testing, like test my blood, give me an X-ray, do something, because I'm not getting better. And I have not seen that doctor. I called him, or my mom did, I think, when it was all said and done, but I couldn't bring myself to go back to him. And we loved him before, so I just don't know how that part, like, there's no protocol of like, when someone's coming back with the same symptoms, do something different, do the next step. So
Right.
clearly I wasn't getting back. So that was like the beginning of the week or the weekend or something. And then I took a whole round. It was called Bactrim. It's a sulfa drug. I never knew about these things either, whatever. But by the next weekend, I had a rash on my chest. I had a rash on my arms. And I'm like, what is this? So I said to my husband, I have a rash. He's like, I don't see anything. Again, we're just wanting to be normal. And then he's like, oh, wait, I do see it. This was a Saturday. And I have a rash everywhere. And I'm leaving out totally. I had a swollen lymph node. I'm totally forgetting this part. So now, maybe a few weeks before, I had one swollen big here, one on the other side, but like on my collarbone. So that's a sign too that it's not even. It's not like, you might be sick and it's normal that they swell because, if you have a sore throat, they'll swell around the part. That means that your infection is getting cleared by your body. That's good. But this is like uneven, weird. There was no explanation for that. I even asked the pediatrician when I brought my daughter for those checkups. I'm like, I don't know. You think I'm all right? And they would say things like, is it soft to the touch? Is it hard to the touch? I'm going to say it's hard to tell, is it movable? So I'd like try to, I guess, I'd always try to lean towards maybe it was like the thing that would have been easier. But I was never sure. So, I had this rash and now I go back to the walk-in. Finally, I see a doctor. He goes, I don't like the like how swollen you are, how extreme this is, and I don't like the duration. He goes, I'm giving you blood work now. Thank you. In the walk-in.
Yeah.
And he goes, here's a script. Go get an X-ray tomorrow. I said at this point, because I had started Googling, I said, do you think it's cancer? Because I'm like, why do I have these lumps? He goes, we can't jump to any conclusions. He didn't say no, but I understand that now too. I mean, doctors, they can't say yes, no, if they don't have the facts.
Right.
But he's like, I need to, like, he even like was like, do you mind if I press near your groin? I'm like, no, whatever, because it was swollen there too, I guess. I mean, I couldn't tell as much when I pressed down. So I'm like, okay. Like he's touching on my armpit, all this stuff. So I go home knowing that the next day I'm going to go get the X-ray. But that night I started having the highest fevers. We were like using all different thermometers. It was like 103.5. And I didn't even want to know. At one point it was going up so high, like threw the thermometer on my mouth. I started like sort of hallucinating from the fever, but I remember it. I knew it was bad. And my mom and my sister even stayed over. And I was like, because remember, we have the baby too. Like, and my husband's like worrying about all of us. So I'm like, I said to them, I was laying on the couch and I'm like, this is like so sad. But I said, I was imagining having to be taken out by ambulance now. And I'm like, are they going to put my coat on when they put me in the ambulance? Like, these are the kinds of things I'm thinking at this point because I'm getting ready to go. So we didn't go to the hospital right away. My mom was, I remember she was putting like a wet rag on my head. And I was going Tylenol, Advil, and we waited till early morning. So my parents took me. We get there, and then it's kind of like, do you have a rash? Do you have this? Do you have that? If you do, you have to go in isolation because we don't know what you have. This is long before COVID or anything, but still, it's like it could be some kind of contagious thing. So they put me in isolation in the ER, and then they start doing every test under the sun. You think they're gonna just be like, it's cancer, but I would say this: one of the first tests they did was an X-ray, and pretty soon after, I knew there was something showing, and that scared me. But they said, we see something in your lungs and also like in your chest. I'm like, maybe it's pneumonia, maybe. But then I have all these other weird signs. So, this was a whole other story. It turns out that we knew one of the doctors. There's this female doctor. Her father had been my dad's doctor years before, and he had passed away. And she happened to be coming by. She was pregnant at the time. We had a lot in common. So she came in to the room, and when she started talking, we were like, we knew your dad. We all connected, like my family, her, and like that was that first day that she happened to be there. And this is one of those things that's like, wow, was that meant to be that we connected at that moment? I believe so. She said, and at first I was so mad at her. She's like, we got back the X-ray. They're going to tell you that it could be, they said, maybe it's an infection. Maybe it's, she's like, there's going to be a lot of talk of things that we're going to rule out. But I'm telling you now, it's probably lymphoma. It's lymphoma. And I was so upset that she kind of sucked away all hope. But she prepared me because she knew it was. But they can't say it until results come back because by the slim chance, maybe it's not.
Right.
They don't want, to be responsible for that. So then it turns out, like CT scan. I never had any kind of scan in my life. I was petrified for every single step. And I remember there was even an infectious disease doctor who came to see me. And I had like, my face was turning like a little red. They were like, maybe it's lupus, which in some cases it's like, that would have come with its own set of problems because it wouldn't have necessarily ever gone away. So it's very hard. Like you're going through all these feelings like, do I want it to be something that's chronic and I have to deal with, but that's not threatening my life directly, or so I was just hoping that it wasn't cancer, obviously. But this infectious disease doctor came in, and I said, I'm so scared. I don't want to drink for the CT scan, the CAT scan. I don't want to do this. And he was like, all right, well, maybe you could wait like another day. Well, let's see what happens. But I ended up, then other doctors were talking to me, and I ended up getting it. But he came to me, I think it was like pretty late in the night or early in the morning, whatever it was. And he said, once they figured out what it was, he's like, I can't believe it. He was shocked. Actually, most of them were shocked by my story and how I had been pregnant and it was missed. And he's like, I really didn't think that it was going to be. And he's like a brilliant doctor over here. And it was crazy for him to like admit that and come back to me. And so he was, it was very emotional all around. But so now I had the CAT scan, and they're like, we're seeing a mass in your chest. And we're like, a mass? What? This is crazy. And now we start Googling more, and we kind of knew this was going to be lymphoma, like the doctor said. And we kind of even knew there's something called a medial spinal mass. And it was that feeling. And I remember my sister talking to me about it too. It's kind of like, all right, that's it. Everything makes sense. This is going to be it. And there's sort of an acceptance with that. But we had to wait so long. And now we're still waiting. So I'm still in isolation. I'm still getting all these tests. I'm probably leaving out a million things. It got to the point where the doctor on Staten Island said, if you want to be treated here, fine. But you need a PET scan. And that's the scan where everything, in case people don't know, like they inject you with something that's radioactive. We talked about the song. And things will light up anywhere where there's cancer. We needed that. We needed to know if it's spread. I needed a bone marrow biopsy. He said, that is so painful. And to this day, it was the worst test I ever had. He said, if you're going to go somewhere else, I'm not doing these tests. They're going to redo them. So that's, I don't know, you're going to share your story if it's the same thing. He goes, if you switch, they're going to redo their own tests. So I'm not putting you through this more than once. Let's do the PET scan. And then they could do their own bone bone marrow biopsy if you go somewhere else. So I did the PET scan. I kept thinking, I guess I thought it would be like on TV. I thought they were going to call me. So there I am, like up all night. Not that they're going to call me in the middle of the night, but my sister stayed over. We were just talking about this, and I was like, am I going to die? I just kept saying it. And she's like, no. I mean, we didn't know what was going to happen, but it's like, what is going to happen? So I kept thinking I was going to get this phone call of them saying, you have cancer. Never came. Instead, I guess that's probably usual. They waited till that appointment. I go in. The doctor says, sit down. He goes to my mom, sit down. So she's like, what? And then he said, so then I said, I feel like I'm going to faint, like again with this fainting. But I'm like, he's like, do you really? I think my adrenaline was really pumping. So he knew it was not. But I sat down too. My husband was there also. And he said two things. He's like, you have cancer. Well, he said it is lymphoma. But the two things are, it's everywhere and you're running out of time. Now, the way he said it was super dramatic. He was not a lymphoma specialist. Once I saw my specialist, I felt a million times better. But he was right. These are facts. And sometimes doctors can just give you the facts.
Yeah.
He showed me my scan. Literally, I had gone everywhere. But with blood cancer, that's going to be what happens. It's not like going to be in one spot that you could have a surgery and it's gone.
Right.
So, and he was right about the running out of time because, like I said, I had this mass. It was getting closer and closer to my heart. So I was seen by a vascular surgeon because they're like, we might have to cut this out. I'm like, well, I didn't even want to hear anymore at this point.
Yeah.
So now it was like, this is another talk about like how to find the hospital, but it's almost like applying to college. Like you're calling these places. Some of them are saying, no, we don't have room for new patients, or we want to start from scratch with you. But I was told, like, you need to get help right away. A friend of mine recommended Hackensack to me, and they were just so the person on the phone was just so kind, and like I knew right away this is where I want to go. And a couple of days later I was there. I met with the oncologist. She said, we're gonna have to do something called a bone marrow biopsy. I knew it was gonna be bad. She said, let's talk to your family first. I'll tell them the details of what this is gonna be like, and then we'll do it. And then she came in the room and said, you know what, I'm gonna do it first. I know she definitely did that on purpose because if she knew I was going to be too nervous. So I said, you sure? And we did it right in the room. So basically it's a huge needle that goes all the way down. It's so painful, even though they numb the area. It's just, I can't even describe it.
It hurts. It hurts so bad. Yeah.
They did that. It didn't spread to my bone marrow, which was great. But because it was stage 4, when I did say it spread everywhere, it did not spread to my brain, my spinal fluid, I guess you said, or my bone marrow. So like those main parts, I was good. That's why I didn't need a transplant. And also because the chemo ended up working. But they did have to do spinal taps, the lumbar puncture throughout my treatment to make sure, like, give me a little bit of chemo up my spine and in the brain. And like they retrieve fluid too to make sure it didn't spread throughout treatment, which was another whole crazy thing. But now I knew it was lymphoma. She said, I'm putting you in the hospital tonight. My friend who's a PA, he said this could happen. So I already had a bag packed. I was ready. And they put me in the hospital and they kind of like prepared me for chemo. I think maybe like the first night or whatever. And then I started getting chemo like right away. And it's so nuts though, because at that point I'm getting chemo. I knew I had lymphoma. They could tell it was non-Hodgkin's, I think, from the blood work, but they still didn't know exactly what type. And they said it's probably either Burkitt's lymphoma, so we're like looking into Burkitt's lymphoma, or maybe diffuse large B cell, which is actually pretty common. And that's the one that Mark Hoppus from Blink-182 had, and we ended up connecting. I made a video for him, and that type. I've met a lot of other survivors who had that as well. I basically went through the textbook treatment, and I was very lucky. I did not have any genetic mutations or anything that would affect it, and I was able to get my treatment as expected, I guess you would say. And I did it for 5 months, and then, we talked about this already. I won't say I was better, but I got my clear scan. So I had to wait a while, though. I think it was like by the end of the first treatment, they had the results of what the type was. Because I'm not even sure of all the details. I shouldn't even go into it. We probably need a doctor to explain it. But it's kind of like they take these samples from you and then they have to like watch it grow. Basically, I mean, it's not like, I know that's true for bacteria, but for the cancer, they're looking at the cells basically over time. So, you know, you don't look at it the first day and know what it is. You have to see how they behave, I suppose, and what they look like. And whatever they do, maybe they put something in it and mix it around, whatever. Finally, they said, no, it is diffuse large B cell. And that's how we knew for sure. But it took that long. And it's really crazy that was the worst part of it, not knowing what it was. And then once I knew what it was and what the plan was, I could go on.
Yeah.
So that's my story. And I did talk a little longer than I thought.
Oh, I love I loved hearing every part of it. That's so interesting. I mean, that the odds of them finding that, like when they did, and being able to treat it in time, you know, that's just amazing.
I know. If it was probably a couple of weeks later, then I would have had more complications. I would have needed like some kind of surgery or something. I don't even know. It would have been complicated and scary, and who knows what could have happened. But my oncologist will say to this day, what happened to you is very rare. I hate hearing that, but she sort of doesn't blame any of the other doctors that missed it. I still blame them as far as like, especially just the general practitioner, like do another test. If you're still seeing the same symptoms after this amount of time, it should be protocol. Do more testing, better testing. Don't let somebody walk away still so sick. Blood work, what's the big deal? that's it. I don't know. But of course there's all reasons and insurance and this and who knows the real reasons of why it's not routine. But I think people can ask, you know, can you do more testing? I'm not well, but hopefully, you know, when there's other things going on, other illnesses, I was pregnant, other things, you miss them, you miss it. So
yeah.
Now I want to hear yours because I'm taking up too much time. I took up like half the time.
Yeah, mine's pretty crazy. Like I had no symptoms, none, had no clue. Just living life. I was teaching. It happened to be Memorial Day weekend, 2001, and me and my fiance went out to go karting and do some mini golf, you know, and just go to this fun activity down at the Lake of the Ozarks in Missouri, and just having a really good day. You know, I took my kid, and we were just having a blast. And I'm riding a go-kart. I see they have this awesome, one of the most amazing go-kart tracks. And I'm looking at it, I'm like, I want to ride the go-kart. Like, that is one of the coolest tracks I've ever seen. Like, it's uphill and downhill, and it's got all these turns, and, like, that's really cool. And so I go, and I'm riding the go-kart. And the go-karts have, like, this rail, like a roll bar, so to speak, right around my head, like this level of my head when I sat down in the go-kart. And I thought, oh, that's good, you know, so kids don't get hurt. And I thought, oh, should I be wearing a helmet? You know, for a second, I'm a grown up, you know, and it's go-karts, you know, not bumper cars. And I'm riding the go-karts, and I'm having a blast. And you know, when you're playing go-karts, you're just racing. You're having a good time. You're trying to be the first to, you know, get to the end and see if you're the fastest or whatever. And I come around the corner and I go down the hill, and I pass this guy. This was so crazy. This was so crazy to me, and I really can't even. I don't know how to reconcile it other than just tell the story, you know, to anyone who wants to hear, because like I can't explain it. And this guy, I pass this guy. We come down the hill and around the corner, and right there I pass him, and there's another turn like immediately, and I pass him like this, and he comes around. We're in another turn, and he T-bones me right in the side of my go-kart as I'm leaning into this turn. So I'm like leaning, and the roll bar's like right here next to my head. Well, when he T-boned my go-kart, I slammed into, and it wasn't like that hard, like nothing that would have really bothered me too much, other than, oh wow, that kind of rung my bell a little. And but this, like, my go-kart kind of spun, and I stopped, and like I felt really weird on the right side of my face.
Oh my goodness.
And I thought, wow, man, that rattled me. I'm thinking, wow, man, I don't think I've ever been hit hard in the head before. Whew. And the guy comes up to me and he's like, would you like to finish your ride? And I'm like, sitting there, I'm trying to like gather my senses, and I'm like, no, 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 I want to get off. You know, I'm like, I don't feel right. And my fiance comes up to me and he's like, what's wrong with your face? And I was like, what? And he goes, the whole right side of your face is limp. And
Oh my God.
I was like, what? And I knew it felt funny, but you know, I can't see it, so I have no clue. And he goes, oh my God, you're bleeding out of your ear. I was like, what? And so I went like this, and I touched my ear, and I look, and there's a little blood on my finger, and I'm like, okay, I'm going into the bathroom, and I'm going to go check it out. And I just had a little cut on the outside of my ear, so it wasn't actually coming out of my ear. But this whole right side of my face was limp. Like, I'm looking in the mirror, and I look like I just had a stroke. And I'm like, oh my gosh. And I'm thinking, what the heck? How, like, is that normal? I'm thinking, you know, like,
Like from hitting your head. Yeah.
right. And I'm thinking, okay, I hope will just wait it out, you know? And about 10 minutes go by, and it wears off. It wears off, and all the movement to my face comes back. And I just thought, wow, man, that was weird. That was something else. That was quite the experience. And like, I'd never been whacked in the head like that, where it's done that before. And I thought, wow, man, that was something. And just went home, and we went about our day, and you know, went home later. Didn't think anything twice of it. Did get my money back for the ride though.
Oh, good.
And yeah. And the next day I started having migraines, and and I never had a headache a day in my life. And so I thought, well, that's weird. You know, I did hit my head though. And each day for like 2 weeks after this, my migraines got progressively more intense, to the point, like, by the end, like by week 2, like day 14 or so, it was at the point, and like you, I'm tough. I can take so much pain. I gave birth to my son all natural. Like, I'm just tough that way, you know.
Yeah.
So like, for me to say, okay, I can't, you need to take me to the emergency room, I felt like my head was just going to explode. And I was like, there's something seriously wrong, because I've never felt anything like this ever. And so I go to the emergency room, and they asked me, you know, why I'm there. I tell them, you know, I've been having these migraines ever since I got in this go-kart accident. And they're like, okay, okay. Well, let's do a CAT scan and see what's going on. You know, they thought it was like a head injury. And that's kind of what I was thinking too. And so I go, and I have the CAT scan, and I'm not thinking anything terrible, you know, at all. And he comes back in the room, and like, it takes a while, you know, for all of this to happen. And he comes back and tells me, sit down. And I'm thinking, okay, well, a lot of people can't handle stuff, so I can handle stuff, but okay, I'll sit down. And he puts the CAT scan image up and shows me I had a tumor. And what on the CAT scan, it showed it was the size of a golf ball around my ear canal. And he looked at me and he said, "You have a tumor in your head and neck." And I was like, "What?" I felt like kindergarten cop, like Arnold Schwarzenegger in Kindergarten Cop. It's not a
Yeah,
tumor.
yeah.
Like in my mind, I'm like,
Well,
no, it
yeah.
can't be a tumor. It can't be a tumor. I got a tumor. No, 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 no. And then it's like reality hit me pretty quick, and it was like, oh, oh my God, I got a tumor. Ah. And my son was only 2.5 years old, so it was like that was a surprise. I'm thinking, I just panicked at that moment, sheer panic, like tears and just ah. And then it was like, well, you need to see an oncologist. And like that was at the emergency room at just a general hospital. And so now I'm like, well, I don't know anything about this stuff. Who do I see?
Right.
And they're like, well, we can give you a referral. I was like, okay, I was new to the medical world other than having my son. And I'm just going by what the doctors say. So he gives me a referral. To a doctor, uh, I guess right there in Jefferson City, Missouri, where I was living at the time. And so I go. I think it was like they got me in within a week or so, pretty quick. I was surprised, but they knew like, hey, this is serious. She's got a kid and she's got a tumor in her head. And so I go to see this doctor. Now my I had Medicaid is all I had, because I was a single mom, and at the time, and even though I had a fiance, but we weren't living together or anything like that. I didn't want to do that. So anyway, I was like, okay, well, I've got insurance, and I really wasn't even thinking about insurance. Honestly, I was just like, let's get this dealt with. I'm freaking like, oh my God, I don't want to die because that's what my first thoughts was, oh my God, I'm going to die. Right. And so I go to this doctor and he looks at the CAT scan results and he comes in the room and he's like, yeah, you got a tumor in your head and neck. And he goes, I'm sorry to tell you this. He goes, but I don't take your insurance. And I'm thinking, then why was I sent here? Like, I'm all confused now at this point. And I'm like, and I looked at this doctor. I'm thinking, what do I do? I don't know what to do. Now what do I do? Yeah, I just found out I got a tumor. I got referred here, and you're telling me you don't take my insurance. Well, who does?
Right.
So he gives me another referral. So it's even more time goes by that I have to get in with another doctor, and I have to travel like 3 hours. And it finally I get to this wonderful, wonderful doctor up at Barnes and Jewish Hospital in St. Louis, and he was a professor, and I think he's still actually a professor to this day. Wonderful, wonderful doctor. And he sees me and he's like, whoa, okay, we got the CAT scan results. Let's do an MRI. When they did the MRI, they found out that no, it wasn't the size of a golf ball. It's more the size of a lemon. And, and then they were like, okay, we want to do a biopsy. And I was like, a biopsy? And it was really kind of I didn't know that they were going to, everything happened so fast. Like, they kind of just bombarded me. Like, they came in the room and like, we're going to do a biopsy. Is that okay? I'm like, sure. And they did a biopsy, which was behind my ear. No numbing, no nothing. And it was an awful experience. It was so painful. I literally went into shock. My body went into shock. By the time it was over, I was drenched in sweat, started my menstrual cycle even like 2 weeks early, just because my body was in shock. And from just all the pain that I had to go through for that, it was just excruciating. And, and the PET scans, and stuff. And the more scans that they did, the bigger it was. They saw that it was. And by the time I had my surgery, like it was the size of a softball.
Wow.
And in my wrapped around my ear canal and attached to my seventh nerve. And my surgeon before the surgery, he was telling me, you know, like, this is what I'm going to be doing during your surgery. We're going to have a team of doctors, one for your hearing. We're going to try to save your hearing as much as possible. A neurologist to do the nerve graft because they took a nerve from my foot because they had to sever my seventh nerve to remove the tumor. They took a nerve from my foot and graft it so that I could use the right side of my face again. And he's telling me, and it's quite graphic, like what he's got to do. And I'm by this point I'm calm. Like I'm like, okay, I did my crying, my freaking out, and now it's time to listen. I have to listen and make the proper decisions because this is going to affect my whole rest of my life, and that affects my child's life. And okay, you know, and I'm listening intently, and I'm like, okay, and it's some, you know, if you're not used to hearing about surgery stuff, like most people, a lot of people couldn't handle that, wouldn't want to hear it. They'd be really freaked out by it. And yeah, I'm just sitting there calmly, just listening.
And meanwhile, it's you, right? Like people might freak out just hearing in general, and they're talking about you and your body. It's almost
Right.
like it is a nightmare. It's like it's unbelievable.
Yeah, and that's why I don't go into detail unless someone asks me about it because it's like it's pretty intense, you know. And so he tells me all of this, and I'm listening, and he literally stopped speaking, leaned forward, looked me like dead in the eye, and he goes, "Do you understand what I'm telling you?" And I was like, "Yeah, I. What do you want me to do? Like run around the room screaming and crying? Like I did that already. Like now it's, you know, time to focus and I have to make proper decisions, you know. And he kind of was taken aback and surprised that, wow, I've got a patient that's okay with hearing about all this. And all right, and he just went right back in there explaining everything that he was going to do. And, you know, I ended up going through two 15-hour microscopic surgeries. The first one seemed to go real well. Like I remember waking up and just thinking, I made it. I can't move, but I can look around. And
Yeah.
and just being happy, like I made it. I made it, you know. But they didn't end up getting all the cancer the first time. And so about a month later, I ended up back in the hospital and had another 15-hour microscopic surgery. And it, uh, it was very complicated. And I actually died on the table during that surgery. And it was kind of scary, and it was, you know, really intense, and a lot of months in the hospital altogether, and just, but it was just crazy, like going through all that because I had no idea, no symptoms at all, that I had a tumor the size of a softball in my head and neck. Like I still to this day I think about that, and when he told me, like, adenoid cystic carcinoma is very slow growing,
Yeah.
and he said, and I had to ask him. I said, well, how long do you think I've had this tumor? And he said, well, by its growth rate, he said, since you were 16.
What? How
I
old were
was
you at that point?
I was 22. I was 22. Yeah. And I'm just thinking I was pregnant then while I had this tumor. Uh, and then my next question was like, well, does that mean my son is going to get cancer? Like I had that question. Like
Mm-hmm.
you just, you're, you know, as a parent, you want to protect your child.
Of course.
And to think that I had a tumor while I was pregnant, it just frightened me as a mom,
Yeah.
and so I had to ask him, and he goes, no, and it's just to think of, like, I had that all that time, I had no idea, and it was just a freak accident that caught it, and it was stage 4.
Mm-hmm.
When he found it, he said, you are a month shy of being inoperable.
Wow.
Yeah.
So that
And
that go-kart had to happen at
yeah,
that point. Like, think
yeah.
about it.
And the weird thing was, like, when I got off that go-kart, and like, I was so upset at that guy. Like, I wanted to yell at him and say, this is not bumper cars. Hey, you hurt me.
Yeah.
Like, and do you know, okay, like, the whole, like, I stopped my car and stopped the ride. The whole ride was going. And if you've ever rode go-karts, you go until the ride's over. Nobody stops,
Yeah.
right? And I was the only one that stopped. I was so upset. I'm looking for that guy. Nowhere to be seen. And neither was his go-kart.
Wow.
I cannot explain that. I
Wow.
cannot explain that.
Yeah.
Just like, I think about that, and I'm just like, that is just the wildest thing, because the odds of finding out just in the nick of time to have it taken care of in time,
To,
and not have any
and
symptoms.
to think it was there all those years, and then
Yeah,
the growth that happens just while you were being diagnosed,
yeah,
right? Like, I guess maybe it started like accelerating at that point. I don't know. Or like you said, it was just they caught it at that point. But that's
yeah,
unbelievable. It's really unbelievable.
yeah. I mean, that, and as mad as I was, once I calmed down about the situation, and realized, hey, I've got cancer. I thought, that guy saved my life.
Yeah. Right.
Like, wow. Yeah, because I would have never have known if that wouldn't have happened, and I would have died.
Right.
Being 1 month away from being inoperable was like, wow, what
Mm-hmm.
are the odds of that? You know,
Yeah. The timing of it is
yeah, yeah.
crazy.
And yours must have been just absolutely confusing. Like, I can see how confusing that must have been, and scary.
And you're talking about being like strong. You want to be tough, and you think to yourself, well, all these girls I know, all these women had babies. Why am I having such a difficult time with it?
Yeah,
Why am I feeling sick yet? Why don't I feel better yet? I got to snap out of this. And it's like, no, cancer. Another thing you said was about biopsies. I'm totally forgetting. I talked about the bone marrow biopsy, but there's so many pieces to being diagnosed. And that was, I think we might have just said like, and other things, but I had to get biopsies. Like, I actually had a lymph node. They took it out. Um, they had to take it out. And then, like, I guess they study that as another way to find out, like, what kind of cancer it is.
mm,
And that results that took long. And they also did a biopsy. First, they did the chest. They put a needle like in my chest, but it's these crazy things. Like, I could feel pressure and a little bit of pain, so they had to give me like more medicine. Like, I'm like, I could feel that. Am I supposed to feel that? And they were like, well, is it painful? I'm like, and it's like hot. I'm like, I don't know. I'm just so nervous. But I think I feel a little pain and I feel the pressure of the needle. So then they gave me more medicine, and I just felt more. It was so weird. Like, you feel something's happening, but then you don't feel the pain. And like, they didn't. It's all these kinds of things. They didn't get enough results from that. And then they're like, okay, now we are going to take an actual lymph node out. So there's a lot of like back and forth, and nobody's case is going to be the same for being diagnosed. I'm sure some people have easier cases than we did, but I think that everybody has, like, it's like a trial and error for the doctors because everyone's different. So, if they don't get a good sample, or if things change, and mine also, I want to say, grew when that doctor said, you don't have a lot of time. From when I had like my first scan, I'm in the hospital a week. Judging from that till the end of that week, they're like, you need to get treatment right away. So
yeah,
it's so important, if anybody ever like suspects something, it's so important for people to go get checked and to try to get answers, and get the treatment going to make your case easier, less complicated.
yeah,
We have like so
yeah.
many great
It
comments
happened
by the way.
really fast. It happened really, like, once. they know. It's like everything happens really fast. I was really surprised. Yeah.
Yeah, I agree with you on that part too, where it's like you kind of just say yes. They're doing all this stuff to you, and it's your body, and you kind of just you don't have a choice. I mean, you're not going to say no because then you know you're risking your life if you're in the
Right.
situation for stage 4. But it's also just kind of horrible that you have to agree to all these things. And I'm
Yeah.
a control. That's why I at first was like, do I need this test? Like,
Yeah.
are they right? Do I have this? I don't know if I should do this. So then I just started. Once I found that oncologist, I totally trusted her. Whatever she did to make me feel that way, I don't know. It's the way she spoke and explained things. I felt like I could trust. But I was going to say the chat. I don't know if you're seeing it, but we have like lots of support. So I want to thank everybody in there in the chat. I don't know if anybody wants to just write in the chat if anything about being diagnosed or anything they want to share. We could look at that. Um, but yeah, it's just getting diagnosed is just it's so hard to describe. It's different, like I said, for everyone.
It is. And like it depends on like what like each cancer I've had, it's going through the diagnosis was different each time.
Mm-hmm.
Each time. With my breast cancer, it was, I caught that one myself doing my just monthly breast exams myself. And when I felt some lumps, it was like, oh, let's go to my gynecologist. Let's have her look
Mm-hmm.
at it. And she's like, oh yeah, you caught that. Yeah, let's go see your oncologist. Go get this checked out. And it was stage 2. So I'm glad I did that.
Yeah.
Who knows, what stage it would have been, or if I would have survived if I wouldn't have caught that. Yeah. And that one wasn't too bad. I found that one out through a phone call though on my 30th birthday.
Okay. Yeah. I kept expecting that phone call, but
Yeah,
they told me in person. That
I
was
was a
terrible.
little surprised that they told me over the phone
Yeah.
because didn't. That was my first experience with being told something that extreme over the phone, and I took it hard because it was my 30th birthday too, and I just was like, oh, you know. But then you get focused,
Then you
at least I
go
did.
like I think Amanda said the other night, like the fight or flight, like in it, and you gotta do what you gotta do to survive once you get your plan. But waiting for it is hard.
Yeah,
Uh,
yeah,
yeah, I think like on TV. I mean, obviously they're not gonna make a movie or a TV show have like a very very long section of lots of tests. But I think for me, like I didn't really know personally people with cancer or about like the details of it. So I think I knew from watching things, and it's kind of like, oh, I feel a lump, or oh, I feel strange, and then the doctor's just like, it's cancer, and then, but the whole process is so lengthy, so many tests. I don't know about all the other types of cancer, but I can't imagine that there's any type where it's just like so black and white. I think that there has to be lots of testing, and then there's like staging and finding out what type, and
yeah,
it's so hard to during that part.
yeah, and yeah, no, and it's weird because and in some places it depends on the treatment center you're at too, because some are like all over genetic testing, and they're testing that stuff all the time, and they're like, oh well, you're okay, you're going through breast cancer, let's check your genetics. Oh, hey, you got BRCA1 or BRCA2, right? And I didn't experience any of that until after my breast cancer. And then it was like they were like, okay, wait a second, what's up with this girl? Like
Yeah.
she has a really rare form of cancer that's normally found in geriatric patients, elderly patients. Why? Like now she's got a secondary cancer, totally unrelated,
Yeah.
first in her family to have breast cancer. What's going on with her? And that's when they were like, hey, all right, would you be interested in some genetic testing? And found out I had a mutated CHEK2 gene. And that was great information to have. That's great information to have because that lets me know of like, well, what kind of things might come along with having that mutated gene. And so I can have some kind of uh, like pre- preventative medicine, so to
Yeah.
speak, and keep an eye on things before it gets to like stage 3 and 4, hopefully can catch things early if they do pop up.
And I think sometimes people, I've known people who did have mutations for my type of cancer, and they had a much more difficult time. Maybe their treatment didn't work and they had another treatment, or they had transplants, stem cell transplants.
Yeah,
But I guess I didn't know anything about that either, like how important it is. These, like, what's a genetic mutation? What do you mean, like, that the
yeah,
treatment? Why would the treatment work for someone and not someone else? And then I'm like, oh well, it has to do with your own genes. You can't do anything about this. This is just how you are.
yeah,
Well, cancer to begin with, I don't know, but my genes weren't. I didn't have that mutation, so that's why, for me, I was able to go through. But it's like, when you're being diagnosed, also if you have other health issues or you're a certain age, there's other factors that will affect what treatment are they going to give you. They gave me a very aggressive treatment where I had to stay in the hospital 5 days at a time. I had to stay there 24-hour drip, so I had to be there overnight because the chemo was just constant.
yeah,
And they said your body can handle it, but it's better because we're going to get rid of it, which it worked. And some people who had this thing had a different, different.
yeah. And for me, it was like tons of surgeries, just surgery, hospital, lots of recovery. Like the surgery for that was so intense. Like, yeah, that was intense. And like afterwards too, the adjusting, because I I had so much disfigurement, and I was so happy to be alive and to make it through all of that, but it was really hard for me. Like I literally took down all the mirrors in my house. Like I was just like, I don't want to look at myself right now.
Yeah,
Like I don't recognize this person in the mirror.
it's so
Yeah,
terrible. I slightly experienced that with the hair loss. I know it's a totally different level, but you go through so many changes during treatment. And it's a different issue, right? Like, so you're feeling sick, but then you're looking sick. And then you have to deal with that too. It's just really hard to do all of this at once, experience all of these feelings,
yeah,
because you want
yeah,
to say, who cares what I look like? Like you said, like, I'm alive. This is what matters. But that matters too. You want to feel good
yeah.
about
And I
yourself.
honestly really, at first it was like hard, like, oh God, I look like, ooh, I don't like this. I don't really recognize myself. But it was like, okay, it'll get better. I remember telling myself, it's okay. Like I knew that, it was gonna be like this. But it was other people's reaction to seeing me
Mm,
when I started to go out in public, um, for the first time. That's what made me self-conscious. Like I didn't care that half my face didn't work. I didn't care that I couldn't speak or eat quite well. I could eat, but it was tough. And it didn't that part didn't bother me, but like other people's reactions to seeing, the disfigurement and all of that and the scars, and they were just like really taken aback. And that made me very self-conscious, like so self-conscious. And I that was kind of what led to like the taking down all the mirrors.
when I saw one of my friends after it all, that summer, and my hair was starting to grow back in, but I decided to go to this barbecue with no hat or anything. I was like, I don't care. I don't want to wear my wig. I'm hot. Shaved head. I guess it was a little bold of me, but I just felt like this is me. And she was a little choked up, which made me feel a little upset because it became so real. It was like I had talked to my friends about it and everything, but then just to see me, it's like, wow, I think it's kind of like it happened. Now we know it definitely happened. Here she is. So I definitely could relate to that. It's just all so crazy. I can't even believe it, but I'm so happy that we are sharing and able to do this. I think it's it's helpful for us, it's helpful for
Yeah.
others.
Yeah.
And
And
like I said, can you see the chat? We've gotten a bunch of people here, which I'm really appreciative
there's
of. And
uh, 3 people viewing.
so, but like throughout, people were coming and going. So I think we could probably scroll back later and see some of the comments.
Yeah.
But yeah.
Yeah, I've seen Engon's.
I
Uh,
pinned
uh,
one. That is
yeah, yeah.
what
That's my friend. Yeah, that's why I salute you, Alicia. You fought all the pain. Actually, we can convert the pain to fuel. I did too.
mhm.
Like I totally did. Like I just took every ounce of stubbornness that I had in me and just used that to my advantage for the first time in my life. I was like, this is now working in my favor.
Yep. Got it.
I made a funny reel about that not too long
I got it.
back. Oh,
Yeah. So I mean, I guess that's about it for us and our stories with being diagnosed, but we definitely want to share much more going forward. Um, so we'll have this up on my Instagram. I'll tag you too. And I guess I'll just summarize. If you want to say any last minute thoughts, I'm just going to say again, being diagnosed with cancer is not just a very easy thing where someone said, you go to your doctor with a symptom and you hear it's cancer, like you would, it's an upper respiratory infection. It's not going to just be easy to diagnose. It's going to be testing,
yeah,
probably answers, because they're not going to want to say something until they know, and a lot of
a
waiting.
lot
And that's what I
of waiting.
hardest
Yeah,
part. So all I could say is, if anyone's going through it or knows someone going through it, just kind of prepare yourselves for the waiting. Because I think if I knew a little bit more about how long I'd have to wait, it would have been easier. Because I kept thinking, oh, maybe now they'll tell me, or maybe this test, and now I understand the process.
yeah. I now call it the hurry up and wait game.
Yeah,
Yeah,
exactly.
because like you hurry up to get all this done, and then you wait to find out the results. And it's like, oh, the
Yep.
anxiety. Yeah, yeah.
I guess we'll
And
wrap it up. Oh, I'm
oh
sorry. I'm cutting you off.
no, I was just gonna say it's just such an emotional roller coaster ride, because you don't, you, at least I felt like, I don't know, I felt like I was getting tossed to and fro, just kind of, going from one doctor to the next, trying to,
Yeah, that's
so,
it. An
yeah,
experiment, but it is, because even if they are an expert at that type of cancer, it's still, every case is going to be new and
yeah,
built in its own way. So
yeah. Yeah, and each one of us is different with it too, that's why they got to test it and make sure, okay, I was surprised when they told me chemo wouldn't work on mine too.
mm,
And I was like, okay, then what are my options? And they were like, we think radiation will work. I was like, well, let's do it.
so you had this
You know,
first and then the radiation.
yeah, yeah. In total, I had 35 radiation treatments to my head and neck. And then when I went through my breast cancer, I had another, which was like 8 years later, had another 35 rounds
Mm,
of radiation, same strength too. And then with my third cancer, which was a metastasis in my right lung, the same amount of radiation, but in what they call SBRT
okay.
radiation. So it's like laser, it's very pinpoint, but only in 3 treatments. And it was so powerful that it had to be every other
Wow.
day, and only 3. And that was like, it was that much radiation all at once. So I have so many side effects from the radiation. Like I have an autoimmune disease because of the radiation.
I was going to say, and isn't that interesting how, I mean, it could just be that it was like a different type of cancer that, so they use that. But I was going to say this before too, how like immunotherapies are becoming more common. Things are progressing with treatment too as time goes on, which is great
Yeah.
for people. So there's even more options for doctors to choose from, which I think is great.
Yeah.
Less invasive, maybe some of them are.
Yeah, and I the more I see that, it's like I'm so glad that they're coming out with more options, and now they're starting to target too. Like they can actually test your cancer with each chemo to see which chemo it responds to best. Yeah, which I think is awesome for so then people don't have to go through these hard
Mm-hmm.
experiences of having to switch, chemos in the middle of treatment, things
Right.
like that. Yeah,
Right. I could figure it
because that I can only imagine how tough that must be,
out.
and scary too. Thinking, oh well, that one's not working, and now I've got to start another one. And
Yeah.
I would imagine I would feel like, oh, did I make any progress, or
I
am I doing
know.
right? Did I waste time, or what? Like, yeah. So
Right. All right. So I'm thanking everybody for watching,
yeah, thank you, everyone.
and we're going to be back soon. We'll discuss a new date and time.
Yeah, yeah.
Right. So I hope you have a good day. See everybody later.
Yeah.
Bye.
Bye, everyone.